Hmm. Hello, everyone. Good evening to all. Sir, is my audible the voice? Hello, hello. Is audible? Yeah. Okay. Thank you. So, good evening to everyone. I wish I thankful to for Autism Connect. Given that this wonderful opportunity to me. You know, uh, given uh, given the wonderful opportunity and conducting that online live webinar, and very thankful to that. So as we all know that, so we uh, celebrate last April 2nd, so World Autism Day. So I think you people know that and aware that very well about autism on that. Anyway, I will be go on that first of all. So history of autism. Okay. So first of all, before we start that, this webinar, we just know that what is autism. So where the terminology come from that. So that meaning of the autism is a Greek word. Okay. It's autism means autos, means the cell. Okay. In 1911, the Egan Bluer introduced the term of autism, people who are disconnected with other world, schizophrenia disorder. Okay, first of all, he only introduced that first of all the word of autism, and he diagnosed to the adult people, and then later on that he diagnosed with the those phenotypical features in children also. So that's why he created the one terminology in autism. So mean of the self. Okay, and as well as after that, a few years back, a few years later on that in Skinner also he given that the term of autism, and he's a Austrian psychiatrist and has Asperger's syndromes, and he finds that uh, in group of adolescent also. Okay, and then there are many definition will be there in autism. Okay, so I don't want to go much definitions on that. Autism is a lifelong disability that affects the brain functioning in especially those areas in the brain control, social ability, and communication skills. It is not a disease; it's a developmental disorder of a brain functioning, which is first described Leo Kinner. As I told you that no, the first described that in Asperger syndrome, as well as there are many definition will be there. Okay, according to DSM-5 and ICD-11 on that, I don't want to go much that. So I just go short and in a simple way only. That American Person with Disabilities Act in 1990. Autism is a developmental disability, significant affected verbally and non-verbally communication and social interaction generally before age 3 years, which is observably affect children's educational and performance. Okay, so these are the definition will be we discuss it on that, and mainly in children with autism, the effect on that speech and communications and the behavior, and as well as and their education performance and day-to-day life skills on that. And then what are the causes, symptoms first of all, phenotypical symptoms, phenotypical features and symptoms on that. So what are the symptoms will be we seen in the especially autism spectrum disorders on that. Mainly, we see that in social areas, mainly social areas, and as well as communications, and as well as behavior problems. These are the main and major only in that in neurodevelopmentally. So, what are the symptoms in the we see in social behaviors? Okay, So social behaviors, the children with autism, they have in a less attention towards to the people, interacting one and another group, one to one, and as well as one to group also. And there are, lack of, communicate also and respond to their own name also. They are able to respond that when group of when people will call that, even though their own family members also, and have that less eye contact, and difficulty to making them maintaining the friendship, and as well as peer interaction group, and delayed interaction, delayed interpersonal developmental also, and less uh, expressive skills, and as well as receptive skills, then able to share their command, their own thoughts, and they are unable to follow the same instructions also in a one way pattern and multiple way pattern instructions. So these will be seen in that social behavior, and as well as communications symptoms. Okay, in the communication symptoms, problem with both verbal and non-verbal, and expressive skills and non-expressive skills. And this is a communications, okay, and delayed in lack of language development, and they remain them mute throughout their lives, and they are mainly anxiety they can be feel on that. So they can talk with the parents, but they are not talk with the others, strangers, and strangers as well as social groups. Normally in the schools and normally in their friends. Okay, and this in the communication also they have might be echolalia behaviors, and poor understanding the languages, might be people uh, they are staying here. First of all, they are children with autism might be in a foreign culture. They're staying in a India, but they are living in the USA, but they won't be understand that in USA slang. So they might be difficult to grasp that phonological, and as well as grammatical words, because Indian slang way this is a different, and and USA slang is a different. They're difficult to understand, and they're difficult to adjust the language also. Okay, and then behavioral pattern, if you see that, so they won't be sit at one place, and they have in hyperactively, and they have stereotype behaviors, and as well as repetitive behaviors, and temper tantrums, and as well as odd behaviors, and they show that visual stimmings, and they show that phenotypic physical stimmings. Okay, this thing will be we seen in the majorly in the children with autism. Okay, and then diagnosis. What how we can be diagnosed with the children with autism? So what are the uh, assessment tool will be there, and how we going to be diagnosis on that? So there are many tools will be there. India also developed that many tools, and as well as in worldwide also developed that many tools. Okay, and in India there are one assessment tool will be there, ISA, Indian Scale for Assessment of Autism. So in these assessment there are five domains will be six domains will be there, and one is the social relationship, reciprocity, and the emotional responsiveness, and the speech and language communications, and the behavior patterns, and sensory aspect, and cognitive components. These assessment we using in all over India, and this assessment till 3 years to 18 years and more also we are using, and as well as uh, CARS, childhood autism rating scales too. So this is, I think, worldwide will be using on that. In this assessment, there are 15 domains will be there. We have to be observed on these areas: the relation of the people, imitations, and emotional response and body use and object use and adaption of use, visual response and listening response, taste, smell, touch, response to the use, fear, nervousness, and verbal communications and non-verbal communication, activity level, and level of consistency and intellectual response and general impressions. As well as this also above 3 years, and we use in generally again before 3 years, 18 months to 24, 16 months to 24 months. 36 months, 30 months or 36 months also we can be used that MCHART, modified checklist for autism in toddler. Okay. So in these, have that only just open-ended questions to the parents. Okay. So there are only few only there in a 20 questions. The high, medium, and high, and then high risk of the autism. Okay. And then causes. If you ask me that causes, there are not only one causes will be there. So there are many causes will be there. Environmental factors and the genetical factors. In the genetical factors, genes maybe they have that in the pair, both side parental, and there are the high chances of borning high chances of borning to the monozyte chromosomal, and as well as uh, autism ASD research that show that higher male than female. Okay, and genetical risk factors and environmental risk factors. So, and the parental risk factor, before birth in the prenatal stage, and then the perinatal stage also. In the prenatal stage means during the pregnancy, how the mother caring to the child, the some food, and then the lifestyles and the environment setup, and how the mother taking care of baby in that you know uh, embryonic stage. So and during the pregnancy time, mother should be avoid that consuming alcohol and the smoking and other things also. And then perinatal skills, perinatal infections, the viral infections and immune systems, and a birth cry, and oxygen if delayed in any other epilepsy. This maybe have that children with risk factor on that. Again, and other malnutrition and other factors also. After postnatal immunizations if not given that proper as per as per the schedule also, it may be effect on that. So there are not only the one cause, it may can to describe. So there are a number of will be there. So there is a short time for me. So that's why I just orally I am going on that. And then treatment and management program. Okay. So if you ask me that the treatment in intervention, so there are medical model also we have to go, and as well as rehabilitation therapeutic model also we have to go. So if you go that in if you go that in a medical model, so there are allopathy will be there, and as well as homeopathy, Ayurvedic, and naturopathy. So these will be help the children with reducing the their uh, behavior aspects, as well as their communication aspects. And if they might be have any comorbidity conditions such as attention deficit hyper disorder, or intellectual disability, or else epilepsy also. So we can be go in this medical model and give that treaty intervention for them, and as well as the rehabilitation model. In this rehabilitation model, so we will give speech speech therapy, occupational therapy, and physiotherapy, and the special education, and other therapeutic also. If you talk about, if you give that, social skills training in that social skills training, the modeling and the role play, greeting to the others and the sharing to the object, and reciprocal conversations and emotional intelligence training. And if you see that in a behavioral intervention, eliminates the under eliminates the under describe the behavior, and anger management. And if you see, we can be managing on that anxiety management and behavioral modification, which is have that, temper tantrum, aggressive behaviors, and stereotype behaviors. Okay, and as well as we have to go in the speech therapy and intervention. In this speech therapy, we teach the spontaneous speech, and assisted the method of the teacher vocabulary, and speech therapy can help the reduce the echolalia behavior. Children with autism, they might be have that echolalia. In that echolalia might be delayed echolalia or else immediate echolalia. We can be reduced on that. And picture exchange communication systems, time delay procedure, and video modeling for the we can be management for the speech and language model wide. And then educational interventions. In that education intervention, we can use, there are multiple teaching strategy will be there. Teach method and ABA method, applied behavior analysis, uh, and as well as PEC method, picture exchange communication skills method. Okay, there are this this model will be there in the educational also. In they can be learn that in a pre-writing skills, and as well as pre-reading skills, and pre-arithmetic skills, and pre-conceptual thinking also, and the reasoning and the arithmetic also. In that skills, they can be enhance their ability to promote their quality of life in a day to day. Okay. In that occupation therapy, occupation model interventions, in that occupation model, we focus on that majorly in sensory issues. Children which have that, touching, and as well as visual, and as well as smelling, as well as, auditory, as well as tactual. So if you give that, occupation therapy, occupation intervention for the children with ASD, help the sensory integration wide and visual skills and the stimulations, and they can be learned in effectively, and they can be play, a role fully, and care and for the themselves, and independent dressing, eating, and grooming, and using the bathroom and coloring also. If you give, proper and accurately in this therapeutic model, they can be enhanced these areas. And as well as, so okay, these are the, basic thing will be there. And what are the movies, will be there for the children with autism. So Barfi, My Name is Khan, and as well as मैंने ऐसा है हूँ, मैंने ऐसा हुआ हूँ, Antara TV serial also, and as well as the Good Doctor web series also there. There are many movies will be there in that movie, so we can be understand that exactly different symptoms and different phenotypical features, and what is what autism. Okay, so thank you for watching this my small understanding the autism webinar. Thank you, and thank you so much. So if you have, if you can I, if you advise to me that, please give me that, comment box in a chat box, so I can be improve that myself. They're giving me the short time, so that's why I just go in a oral wide. So I'll be go in again next webinar in a complete pictorial model with what is what. So I can be, give the brief detail among the children with autism, as well as not only the autism in neurodevelopmental disorders, such as ADHD, in learning disability, in uh, intellectual disability, and other disabilities also. Thank you. Thank you for watching. Have a nice day.
Hello, sir.